Good afternoon, everybody. Allie Neal, Communications Director for LDH. Thank you for joining.
Recording in progress.
That's a good reminder that you can record. This is on the record. You can record this technical briefing. Thank you for joining us. This is a technical briefing on the CDC's latest guidance on the expansion of the availability of boosters. Here to discuss the process, the decision, and what it means for Louisiana are two colleagues of ours from the Office of Public Health. One is Dr. Frank Welsh, our state immunization director. The other is Teresa Sokol, our state epidemiologist. Before I turn it over to them for the briefing, I want to do a bit of housekeeping. One, please do mute your mic, or we will unfortunately have to do it for you if you are not presenting or asking a question. Also, as a reminder, we welcome anyone to these technical briefings, but it is a briefing geared towards the media. So we will be prioritizing questions by the media. So please do, as per usual, drop your question and identify yourself and your media outlet in the chat as your question arises. When Dr. Welsh and Teresa are done with their briefing, my colleague Kevin Litton will facilitate the Q&A. My understanding is Teresa will not be presenting a full-on COVID presentation today. That's not the goal of this technical briefing, but surely if you do have other COVID questions, those are fair game as well, I am told. I think that is it. Okay, and with that, thank you all again. I will turn it over to Dr. Welsh.
Good afternoon, everybody. I'm glad to be here and present some exciting news that I'm sure you're all aware of. The first thing I'd like to say, though, is that people who have received the primary series of both Moderna and Pfizer and the Johnson & Johnson vaccine are very, very well protected. These are some of the most effective vaccines that we've had in history. However, as time has gone on, we have seen that immunity wanes to these vaccines a little bit and put those people who are most at risk of getting severe disease from COVID at risk of getting COVID again and maybe having a more serious outcome. But the first thing I want to stress to everyone is just how effective these vaccines are, even without a booster shot. So as you all know, both the Moderna and Pfizer booster shots are now approved by the CDC, in addition to a booster shot for those who received the Johnson & Johnson vaccine. This guidance is effective immediately. Booster shots provide additional protection against COVID-19 and help strengthen that protection against severe disease in populations at high risk for exposure to COVID-19 or complications from severe illness. So I'm going to go through two groups. One is individuals who received either the Pfizer vaccine or the Moderna vaccine. The following groups are now eligible for a booster shot, and this booster shot would occur 6 months or more after their initial series. These are people age 65 or older, age 18 or older, and have one of many underlying medical conditions that may increase their risk for severe COVID infection. And those are the typical ones that we've seen all along. Diabetes, elderly age, heart conditions, lung conditions, diabetes, obesity, pregnancy. Those are all high-risk conditions for COVID. And then finally, another group that is eligible is age 18 or older that live or work in a setting that places them at risk for being exposed to COVID, including long-term care facilities. And this would be self-assessed by people whether they feel that they need a booster. The second group of people are those who got the Johnson & Johnson COVID vaccine, which you all remember was a single-dose series. Everyone who got the Johnson & Johnson COVID vaccine is recommended for a booster shot at least 2 or more months after their first shot. So the interesting thing that is about this is eligible individuals for a booster may choose which vaccine they may receive as a booster dose. Some people may have a preference for the vaccine type that they originally received, or the place they go to may just have one type of vaccine. CDC's recommendation now allow for this type of mix and match dosing for booster shot. So available data, as I mentioned before, showed that all 3 of the COVID vaccines approved or authorized in the United States continue to be very highly effective in reducing the risk of severe disease, hospitalization, and death, even against the widely circulating Delta variant. vaccination remains the best way to protect yourself, to reduce the spread of the virus, and prevent new variants from emerging. So in addition to that, though, I want to just remind people that we shouldn't lose our focus amongst the boosters, among those people who have not been vaccinated. We want to continue to educate our population about the safety and effectiveness of these vaccines and encourage those people who are still considering getting that first dose of vaccine to do so. As I mentioned, this guidance is effective immediately. Providers may begin administering booster shots as soon as they are able to operationalize this guidance. Residents are encouraged to be patient, check with their local provider, and make an appointment for their booster shot. There is no qualification if a person just decides they'd like to get a booster shot based on consultation with their physician or pharmacist, based on the guidance that has been provided. They may simply present and get that booster shot. Individuals with questions about whether a COVID vaccine booster is right for them are encouraged to speak with their medical professional, and for additional help, individuals can contact the Louisiana COVID-19 vaccine hotline at 1-855-453-0774. I have just a couple points that I would like to emphasize to everyone. We have sent a health alert network message to all COVID-19 vaccine providers, as well as most medical professionals in the state of Louisiana, informing of this change. Louisiana has plenty of vaccine of all three types, so people should not worry that vaccine will run out. However, the limiting factor, especially during these initial few days, is going to be the ability to get an appointment. So please just try and be patient. I wanted to also mention that it's also flu season, and people may have recently got their flu shot or about to get their flu shot. You don't have to worry about that. You can get your COVID vaccine on the same day as you got your flu shot, or any combination. If you just got your flu shot, you can still get a COVID, or you can get your COVID and get your flu shot. But what I want to emphasize is if you're waiting for an appointment to get a COVID vaccine, don't put off that flu shot. You can get it on the same day, but if you have a flu shot scheduled, go ahead and get that and get your COVID vaccine when your appointment comes available. And then finally, just to close out, these are incredibly effective and safe vaccines. We are monitoring side effects from the vaccine. But again, in Louisiana, it remains to be the best protection against COVID and what is going to bring this pandemic down to a manageable level. And I'd like to turn it over to the state epidemiologist, Teresa Sokol.
Okay, thanks, Dr. Wells. Can everybody hear me? Okay, good. So, first, I just want to thank everybody for joining today and being interested in learning more about this really important topic. I think everybody knows that we've made very important progress with regard to transmission since the peak of the Delta surge. But I think it's very important to also understand that we still have COVID circulating in communities throughout Louisiana. As you probably all know, on the front page of our COVID-19 dashboard, we assign COVID risk classifications by parish, and this is really in order to highlight the level of transmission that's occurring really at a local level. And currently, all but 7 of our 64 parishes are they remain in the 2 highest categories for community spread. And this really means that COVID prevention efforts have to continue to be an important priority. So Dr. Welch did a really great job of discussing the benefits of vaccination, but I feel like I have to re-emphasize some of what he said. Vaccination really and truly is the best way to protect ourselves, our families, our communities, and really from the devastating impact of COVID-19, and we have all felt this here in Louisiana. Fully vaccinated individuals are highly protected against severe illness and death. If you all are familiar with the CDC COVID tracker, they have a new-ish webpage that shows national data analysis that has been conducted, and this includes data that has been shared by Louisiana. And what the data analysis there has demonstrated is that unvaccinated individuals have a 6.1 times greater risk of being infected with COVID than fully vaccinated individuals. And in addition, they have unvaccinated individuals have an 11.3 times greater risk of dying from COVID-19 than fully vaccinated individuals. Now, but not only will vaccination protect individuals from severe illness and death, but it's going to reduce circulation of the virus in our communities. And this is going to reduce the risk of another variant of concern from emerging. And while Delta is still currently the predominant virus circulating in the United States and in Louisiana, we really do run the risk with this continued circulation and continued transmission that a variant of concern, perhaps one that has more severe health consequences, or one against which the vaccination may not be as effective as previous lineages, might emerge. Last, I just want to comment on the potential benefits of the booster doses, and especially for those who are at higher risk for severe health outcomes or exposure to COVID-19. I think we're all aware that because of the widespread transmission that occurred during the Delta surge, we've seen a dramatic increase in the number of COVID-associated deaths in Louisiana, and that includes some among individuals who are fully vaccinated. As of this week, we've had 733 COVID-associated deaths among fully vaccinated individuals. But here's something that I think is very important to note. The single greatest risk factor for severe health outcomes among fully vaccinated individuals continues to be advanced age. 75% of the fully vaccinated individuals that have died from COVID in Louisiana were 70 years of age or older. And in addition to that, the most common underlying health conditions that were identified among fully vaccinated individuals that died from COVID here include diabetes, chronic kidney disease, chronic liver disease, and immunocompromised health status. And all of these are listed among the underlying health conditions noted by CDC for either consideration or recommendation of the booster doses. So I think that the opportunity we have now for these booster doses will further reduce the occurrence of COVID-related hospitalizations and deaths among Louisiana. I think those are all the points that I wanted to make. Certainly, I know Dr. Welch and I would be happy to answer any questions that folks may have.
All right, Kevin, over to you. Field any questions?
I do not see any questions in the chat. Does anybody want to just raise their hand or, go ahead and unmute, ask your question?
I have a question, Kevin. This is Jennifer with WDSU.
Yeah, go ahead.
Okay, do you know, or does the Department of Health know, or have they been in any consultation with the places such as universities that are already requiring and other health systems that are requiring the COVID vaccine to see if they will require the booster shot?
I can take that one, Allie. So just to let everyone know, if someone has completed their primary series, they are considered fully vaccinated. Getting a booster dose will, at this time at least, and I don't expect this in the future, getting a booster dose is not part of that primary series and does not count for being fully vaccinated. So the primary series is sufficient.
Great, thank you, Dr. Welch. Does anybody else have any questions?
It's Rosemary Westwood here with WWNO and WRKF. Can I ask you to talk a bit more about pregnant people as a risk group for boosters? We know that those are actually a really low vaccinated group to begin with, much lower than the general public, even though they're at a greater risk of complications. And I also wondered if you could just comment on whether you think nursing parents, nursing mothers should have been among those who would be eligible for boosters, given the potential to provide immunity to their kids.
I'm going to take the first part and then pass it to Teresa for her comments. Unfortunately, pregnant women are at very high risk if they do get actual COVID. As many of you know, in order to protect the baby, oftentimes the mother's immune system is suppressed in order to protect the baby. Therefore, if the mother gets COVID, she can run the risk of getting very, very serious disease. And just as an example of that, we do know of, in the United States, more than 125,000 pregnant women who have gotten COVID. And of those women, more than 22,000 have had to be hospitalized. That's just a remarkable rate, given what the rates are in the general population. And I'm going to turn it over to Teresa. We have some, unfortunately, very sad statistics to report just during the Delta wave in Louisiana.
Yeah, thanks, Dr. Welch. So in Louisiana, we are still looking and conducting medical record reviews to do an in-depth analysis. What I can tell you is that we have had at least 1,700 cases of COVID infection during pregnancy among women here in Louisiana. I don't have a hospitalization rate to be able to provide to you, though I do know that we have had many, at least ICU hospitalizations among both the neonates and the mothers, either postpartum or during their pregnancy. What I can tell you is that since the beginning of the pandemic, we have had 10 maternal deaths and we've had 16 fetal deaths occur related to COVID infection during pregnancy. And I can also tell you that none of these severe health outcomes related to pregnancy occurred in women who had been vaccinated.
And if, Rosemary, if I could just finish up the last part of your question was the recommendation. The current recommendation for vaccination is women who are planning to be, women who are pregnant, and women who have recently been pregnant. And then I noticed a change on the CDC website. If a woman who is planning to be pregnant, is currently pregnant, or was recently pregnant, if she feels she is at increased risk for exposure to COVID, or given that pregnancy is a high-risk condition, she would be eligible for a booster and could just go get that based on her own self-assessment or consultation with her medical provider.
Great, thank you, Dr. Welch. Melinda, thank you for putting your question in the chat, and anybody that wants to ask a question, that really helps us out. So Melinda, do you want to go ahead? Or I can read the question. Isn't the Moderna booster a half dose compared to a full dose of Pfizer, and does that make a difference for how people should calculate which booster they want?
So this is a really tough one. The reason for that is there really just isn't a whole lot of data on mixing the vaccines. There just have been so few studies, and so few studies that evaluated longer term effects. One thing I will tell you is we have seen some slight differences. You can see these on the CDC website between the vaccines and how well they protect you. The main difference between the Moderna vaccine and the Pfizer vaccine is the amount of antigen, the amount of annoying particles in the vaccine. And there is there's a significant more amount of these annoying particles in the Moderna vaccine. So believe it or not, getting a half dose of Moderna still gives you more antigen than in the Pfizer vaccine. But I will have to tell you, it's really not necessarily consequential. If your immune system is going to respond, it's going to respond to a few of these particles, regardless of there's 50 or whether there's 100. So any of these boosters would be good to take. And what I will tell you is there is just no long-term data on whether mixing one combination is going to be better in the long term. What we do know is getting a booster gives you an immune boost, which is exactly what we want.
Great, thank you so much, Dr. Welch. Johnston, did you want to ask yours on mic?
Yeah, sure. Can y'all hear me?
Yeah, go for it.
You kind of answered mix and match on the back end for me, but is this really just a matter of convenience? Now allowing the mix and match, or is there one certain, I guess, first, second dose vaccine recipient that should be getting another one? Is mixing and matching kind of, like I said, for convenience? And then maybe talk about specifically branching off of that, being that Johnson & Johnson was one dose. Is it still recommended they go with their original vaccine for the booster, or maybe turn to Moderna or Pfizer? Thank you.
Sure, absolutely. And I can take the first part of that. In the mix and match, I'm not sure what the basis for the recommendation for mixing and matching was. I do think that it has a significant degree to do with convenience. As many people know, that Pfizer vaccine is a little harder to store and handle, and so it might not be available at as many places. The Moderna vaccine and Johnson & Johnson vaccines are a little better in terms of storage and handling, so it might be a little bit convenience. But I also think that if we take a step back, it really just is about exposing your body to those antigens of COVID again. And it almost, I don't want to say that it doesn't matter, but just getting that reminder to your body about what COVID is what's going to give us that protection. And then the second part of your question, Johnson, if I can remember, I apologize, I forgot the second question.
You're fine. Just because Johnson & Johnson was a single dose and the other two were 2 doses, is there, if there's any, vaccine candidate to switch it up going to get their booster, is it the Johnson & Johnson recipients this may be targeted at?
So I think that's a great question. And when Johnson & Johnson was first produced, it was produced as a single shot. They never really tested it as a 2-dose series. And now that we've done that, we've found that the Johnson & Johnson vaccine is a great vaccine, and it's a great vaccine in a 2-dose series. So again, for those people who did get the Johnson & Johnson vaccine, and that means everyone who got it, it is recommended that they get a booster. It does not matter which kind of booster they had. There's some initial data that shows some really short-term antigen bumps if you get one of the other types, but we really don't know how well that plays out in the long term. So currently, the CDC is saying that the best thing to do is go get a booster. And the second thing, get a booster that's available. And then if you'd like one of a different type, go ahead and get that. But we really simply do not have the data to show whether mixing and matching of these antigens is better than sticking with the same one. We simply don't have that data yet. What is important is that you go get the booster.
Great, thanks, Dr. Welch. Rosemary, I think you had another mix and match question, didn't you?
Yeah, I was just, and I think you sort of answered that, how is someone supposed to decide? It does feel like, given the limited data, it's a lot to ask a person to make that decision for themselves. So if you have anything more to say about like who they're supposed to ask for help on that. But I also just wanted to ask if you could just talk one little bit more about the protection boosters might provide for getting COVID at all, because I do think there remains a big misconception about how well the vaccines do at actually preventing you from getting COVID and thus preventing the spread. I know, Teresa, you did talk about that a little bit, but just to hit that point home again.
Yeah, and so I think that's a great question, Rosemary, and it is important. If someone has confusion about which booster to get, I would have them talk to their medical provider, their primary care provider. You can also talk to a pharmacist in Louisiana. They are well trained on COVID vaccines. And then you can also call our clinical hotline as well. And I gave the number at the end of the presentation. All of those could be resources in this confusing time. And I do respect that. I think the challenge is we just don't have the information. I think, 2 months down the road, 3 months down the road, when we see all these people who got mixed doses, we may have a better understanding of whether there's a combination that works better than others, but we simply do not know. And I'm going to pass it over to Teresa to give those comparisons of how well the vaccine even prevents you from getting infection.
Right. So at the beginning, when the clinical trials were, the data were first collected for the clinical trials for the vaccines, really the end goal was to protect against symptomatic disease. And so it wasn't really until we had real world data that we sort of began to understand the reduction in risk against COVID infection regardless of symptomatology. And what we do know now is that the vaccines do confer protection against infection. It is at a lower level than protection against severe illness and death, which is what we want, right? That's the goal. That's what we all want, is to have fewer hospitalizations, fewer severe illnesses, and fewer deaths. We also want fewer infections because we want less transmission overall and reduced risk for everybody in the community. And what we know now is that, as I mentioned, the national data, and this was for the month of August overall, and this was collected from, I believe, 16 different states, including Louisiana, is that unvaccinated individuals are about 6 times more likely to be infected with COVID, basically to test positive for COVID, than fully vaccinated individuals. We also know that fully vaccinated individuals, when they do get infected, they tend to shed the virus for a shorter period of time, which really translates into their being less infectious because there's a shorter duration during which they're communicable. So it definitely has benefits in terms of preventing infection and reducing the risk of transmission over and above reducing the risk for severe illness. But no vaccine is 100% perfect. And so I think, it's important to have that expectation. I think over time, certainly we'll track data according to booster doses as well. And I think Allie just mentioned in the chat that, that we have information about booster doses in terms of the vaccinations on the dashboard, and I certainly fully intend to be able to track those over time as it relates to vaccine breakthrough cases and deaths as well.
Great, thanks, Teresa. Rachel from the Illuminator has a question.
Yeah, so I was just wondering about the same requirements for the Johnson & Johnson vaccine. Is it just that they have to be 18 years and up? And also, if so, why is this lower than for Moderna and Pfizer?
So Rachel, that's another great question. So everyone who received the Johnson & Johnson vaccine is recommended to get a booster. And the reason for that is I've heard it said on several CDC calls that it probably should have been a 2-dose series in the first place. They only tested it as a 1-dose series. And as you know, that protection against disease was upwards of 58, 60%, whereas the 2-dose series for the other 2 vaccines were around 90, low 90%. So probably there would have been similar protection had the Johnson & Johnson vaccine been a 2-dose series. So I think that's why the recommendation for anyone who got the Johnson & Johnson is recommended to get a booster, and again, of their choice, 2 months after that first dose.
Got it, thank you. And just to add on a little bit here, would you say there's any benefits to mix and match vaccination? I've heard people say that maybe it would make you less sick if you get one. I don't know, I've heard just
right.
little
And I have to honestly say that we simply do not know because not enough people have done it. And the booster recommendation came out today. Anyone who got the Pfizer booster up until this point had received the Pfizer primary series. So it's only in these few cases of mix and match so far. You would hope that the side effects of getting a booster would not be too severe. But just remember, if you do get ill or get a fever or get a sore arm, that just means your body doesn't like it, and that's exactly what we want. We want your body not to like the COVID booster so that you're protected against disease. So I don't think there's enough information yet. I hope in 3 or 4 months there might be information on what's better or worse. But what I do know, again, what I really want to emphasize, if you are in one of these risk groups or you got the Johnson & Johnson vaccine, the best thing you can do is just go get a booster.
Great, thanks, Dr. Welch. Did anybody else have any other questions from the media?
Kevin, I actually see one more question.
Yeah, I do. I wasn't sure if it was for media, but it's a good question. So you want to go ahead?
Okay. Yeah. I'm sorry, Kevin. Let me just answer that question. There was a final question from Cindy. Should people who had COVID, I see, if people were fully vaccinated, then got COVID, should get the booster. And if they fall in one of those risk groups, the answer is absolutely yes. We know that immunity from vaccination wanes over time. And we also know that immunity from actually having COVID wanes over time. So we do want you to get that booster regardless of whether you've had COVID or not.
Great. Thanks so much, Dr. Welch. I really appreciate everybody's attention. You all have asked great questions. Make sure that you reach out to me and Allie if you have any follow-ups. And if you'd like a copy of the video, it should be maybe an hour of processing time, and I'll try to get that uploaded for everyone in case you had any kind of connection issues. But I just want to thank Dr. Welch and Teresa for all of the solid information. Get your boosters. Dr. Welch, you're getting yours coming up, aren't you?
I'm actually just a little reminder that you can get your COVID booster and your flu shot on the same day, which I will get this evening. So, I really want to emphasize to people, both the flu, COVID, very, very important. Get those boosters, get your flu shot.
Safe and effective, get your shots, get them all. Thanks, everybody. We'll end it there, and thanks, everybody, for joining. Have a great day.